We started using Artegraft back in 2002, and at that time we were running into difficulties with PTFE grafts, finding unacceptable rates of thrombosis and complications, and were seeking another graft at that time. We were initially drawn to Artegraft, knowing that it was sort of homegrown in New Jersey. We thought we'd stay with homegrown graft, and were very pleased with its performance. There are many reasons that we've hit upon and have not turned back from our use of the Artegraft or the bovine collagen graft. And I sort of like to look at it as most surgeons would in preoperative, operative, and postoperative issues. Preoperative, there are going to be any number of patients who are not appropriate for fistulas. And we certainly look to do fistula first and follow DOKI guidelines. But in some patients that have very poor skin turgor, particularly among the elderly, or are prone to infection, or are patients that have very small vessels that are just inappropriate for development of fistulas, we have sought preoperatively to determine those patients and proceed with an Artegraft. The intraoperative phase we have found with Artegraft to be a superior handling graft. It feels like real tissue. The anastomosis between particularly the vein and the Artegraft is tantamount to a vascular anastomosis between native tissue. We've gotten away from using a lot of the so-called hemostatic agents that we had to use in great detail with the PTFE grafts, such as Syracuse and gel foam and topical thrombin. We just don't need it with the Artegraft. Postoperatively, these patients can be accessed within 2 weeks. Also, we've found that if an infection does develop on these patients, a local excision rather than complete extirpation of the PTFE graft, which was necessary, will often suffice with the Artegraft. I would like to add that I'm aware of, I made reference indirectly to an article that has recently come out, and I'm very impressed with the article. It was authored by a group out of MGH, Massachusetts General Hospital, and it appears in the Journal of Vascular Surgery, June of 2011. And in this article, they compared bovine graft with PTFE graft, and it wasn't even close as far as primary patency and secondary assisted patency rates, plus interventions being easily twice as many on the PTFE compared with the Artegraft. So both for pre-intraoperative and postoperative reasons, the graft has been a good performer for us in our hands.